So what would make someone a good candidate to do a hip or a knee replacement? It would be a patient that has probably tried everything, tried steroid shots, physical therapy, anti-inflammatories, ibuprofen, Aleve, and nothing is working. They're completely bone on bone, and they're just frustrated. They can't do the things they want to do anymore. Life's not fun, and they want to get back to activities, golf, pickleball, those kind of things. Once you're to the point where that cartilage is completely gone, a hip or knee replacement could be a good option for you. If you're going to get a hip or knee replacements, there are certainly some things you can do to try and decrease your risk. Things like stop smoking. That increases your risk significantly before a hip or knee replacement. Your diabetes, if that's not under control, we won't even consider a hip or knee replacement. We need the hemoglobin A1C to 7 or under if possible. There's all sorts of things that you can do to decrease your risk, increase your nutrition. Before that, we need to get your weight in an acceptable range. A BMI of 40 or under is typically what we use for hip and knee replacements, because over that, the risk of infection is just too high. Exercise as much as you can. Arthritis is actually something that we want people to exercise as much as they can. Now, certainly if you overdo, you're going to be flared up. So there's kind of a fine line there. But, get on a stationary bike, do some walking, slowly increase every day. And the stronger you get before surgery, the better. The other thing is nutrition. You need good protein intake. You can also increase your vitamin D and calcium and some of these basic things. The healthier you are prior to surgery, the quicker you're going to recover and the safer the surgery will be. So what do you need to do once you've decided to do a knee replacement to make sure you're ready for surgery? The first thing is we need to get a medical clearance from your doctor, either your family doctor or your heart doctor. They need to go through your labs and look at your EKG, make sure that you're safe and optimized for the surgery. Other important things that you should do prior to your surgery is to be aware of what medications you can and cannot take, and we will help you with that. There are certain medications and vitamins that actually increase your bleeding risk, and so some vitamins and fish oils and things like that, you can't really do. You need to stop those a couple weeks before surgery. There's also some, new weight loss shots that need to be stopped because those aren't safe to do right before surgery. You need to stop those a week or two before surgery. So you've seen me, we've ordered surgery. You need to work on getting your medical clearances, your lab work, your EKG, all those things you need to safely do your surgery. The quicker you get those done, the quicker you can potentially get on the schedule. But we can't actually schedule your surgery until you have all that initial stuff done. I do want you to come in the next 3 to 4 weeks and see one of my PAs for a surgery education appointment. They're going to be going through with you a lot of different options based on either if you're getting a hip or a knee replacement, anything from laser treatments, iovera treatments, Kinematic, CBD, or EnRoute nutrition. They're going to go through all these things. We're going to detail them a little bit, but you can certainly ask more questions during this appointment. We want you to feel as comfortable as you can getting this procedure, and so we're going to have you come in a few times before to make sure you're comfortable with everything. You know all the different options to try and make this as best experience as we can for you. Thank you for watching. I hope this has been helpful. If you like what you've been watching, then you can hit the like button and subscribe to our channel. And if you want to make an appointment with either me or one of my colleagues, you can certainly call. We have 2 offices, one in Prescott Valley. We're happy to see you anytime. Thanks.